Thank you, ladies and gentlemen. The Indian Railways are in safe hands because when you quote Shakespeare, there's a certain civility. And I haven't ever seen someone quote Shakespeare so magnificently as the erstwhile speaker did. But from Shakespeare, we'll move into more real, pressing issues. During the pandemic, the stars of India were the people who made up our entire healthcare family. Caregivers, doctors, nurses, clinicians, paramedics, and we showed the world that we may not have all the equipment that's necessary, but we have all the heart. Dr. Raghuvanshi heads, as Rini said, Fortis and now Nat Health. So let me begin by asking you, obviously, India spends nothing compared to developing countries in terms of healthcare infrastructure. How do you think we're going to bridge the gap? Because a multi-trillion-dollar economy cannot have a weak healthcare system.
Thank you, Suhel. It's a very good question. And I think it is very important to understand that healthcare and affluence don't have to go hand in hand. And India probably would be one of the countries which would prove that healthcare is not linked to affluence. Because if you look at the systems which in the West, either a captive system or public healthcare system like what you have in NHS in UK, or for that matter, you see the US health system, and the amount of money they spend and what they get. You know the status of NHS. Yeah. They're virtually on strike, there are long waiting lists, etc. So those cannot be the solutions for us. And I think that is why it is very, very important to realize that the solutions for us, we can take inspiration from the different models from the West, but we cannot recreate just one of those models which is already proven to be inefficient. So one of the things which the current government has done and the transformation they have done is by creating the digital health care mission. And I think that is going to be the highway of future for the healthcare. And that is going to transform healthcare in India.
You know, it's interesting you mentioned this. We live in ironic times. Fortis and many other hospitals are captive areas for patients from across the world, and especially, certain countries who want great healthcare. And yet, healthcare in India is not as accessible as it should be. Like if you look at rural India and semi-urban India, you don't have those kind of inroads into healthcare. Do you believe this dichotomy needs to be bridged, and if so, how?
Yeah, no, absolutely. Until we take the delivery to the last mile, we are not going to see the dividend of whatever we are investing in healthcare. India has done phenomenally well during the most unfortunate couple of years for the pandemic. Our system showed that we had some innate strength in that system. We managed pretty well in spite of the fact that, our system is very suboptimal, and as you said, especially in tier 2, tier 3 cities, the infrastructure is not adequate. So there was a gap, but there is a certain innate strength over there as well. Now, to make it resilient and to make it thrive, we need to do certain things. And I think in that, both the public healthcare system and the private healthcare system has to go hand in hand. It cannot be public or private. It has to be public and private. That's the only way to go forward.
So now, if you look at the Indian healthcare scenario, you will observe that we are woefully inadequate as far as oncological research is concerned. There are other lifestyle diseases which afflict our society but don't have solutions. Do you believe, you can be as honest and blunt, do you believe that by and large Indians don't care about preventive health unless it hits them hard? We always believe that there's a God above, he'll take care. So we spend a lot of time ignoring health checkups, preventive health systems, and then we finally get afflicted with some level of disease, and that's when the worrying starts happening.
Yeah, to decrease the disease burden, it is very important that preventive healthcare is put into focus. However, in the current situation, people will fall sick, and I think accessibility of care to all segments of society is extremely important. And in order to do that, I think there are many aspects you mentioned, like, for example, research. There are fantastic institutions which are coming up, like, for example, the Brain Research Institute in IIT Chennai, which is being completely funded by philanthropic effort. So many such institutions of excellence have come up across the country. Research is happening, but one of the most important things in the preventive side which is happening is the wellness center concept which the government is creating. So that is going to essentially screen people for non-communicable diseases as well as some of the infective diseases. And one of the major programs which government has taken on called Nikshay, which is about TB-free India by 2025. So that is a pretty lofty target because tuberculosis is a big problem for the nation, and it causes a lot of burden on the healthcare infrastructure in the country.
Now, you know, the Prime Minister has done something pretty remarkable in One India, One Ration card. Where do you see universal healthcare and how do you see it coming into India? For instance, insurance, health insurance, cashless insurances for the well-heeled and the rich. How do I actually access healthcare, no matter which part of the country I'm in, and access it without fear or favor? Do you believe in your role as the head of Nat Health, there's something that you can advise through your organization and yourself, the government, in terms of what it needs to do?
See, one of the points which you touched earlier is the creation of the infrastructure. But as I was saying earlier, the digital highway which is being created, that will lead to a lot of development on the sides of the highway, just like a regular highway has. And that is what is going to get infrastructure going into these areas. I think one of the focus should be on how to make private investments attractive in other areas, not only on the provider side, but there are many other components of the healthcare ecosystem. If you look at the manufacturing, for example, for equipment, biomedical equipment, pharmaceuticals, etc., that's essentially all private sector, and that's what supports the public sector as well. So the private sector and public sector are greatly intertwined. So I think the policies to make investment in healthcare attractive. Healthcare cannot be just like any other business. Healthcare has to work with a slightly altruistic motive. And in order to deliver that kind of care at the last mile to those who are disadvantaged, it is very important that the investment comes into private healthcare in all the components of private healthcare, whether it is manufacturing, whether it is service delivery, whether it is diagnostics.
So it's interesting you mentioned this. Let's go back 30 years, 40 years, when the first All India Institute of Medical Sciences was set up. The dichotomy or the irony was 50% of the patients were from Bihar, as were 50% of the doctors. So we did not build a healthcare apparatus in some of the states, A. B. I remember when I worked on the launch of both Max Healthcare and then, advised Apollo briefly, the problem was that private healthcare was not able to scale up because of a lack of government incentivization, which is why you had a lot of the hospitals work under foundations or trusts. Where do you see this change and how will it change? We've got the finance minister coming up after this session. I think she's done an amazing job in terms of, easing the way businesses should be done and the realism with which they should be done. If you were to ask for something from a purely healthcare perspective, what would it be from this government?
So in order to take the healthcare infrastructure in terms of creating the manpower, etc., I think this government is already going in the right direction. If you must be aware that every district hospital is going to be converted into a medical college. and a nursing college. So that would give adequate number of clinical workforce for the country. And as you might be aware, that there are two programs which the government is focusing on. One is Heal in India and other is Heal by India. So Heal in India is essentially for people who come from other countries to seek healthcare in our country. And at the same time, we could have another source of exporting manpower to provide services and care to other countries, other part of the world, especially as you know that the nursing workforce all over the world is in short supply. And if we are able to produce larger number of nurses and doctors, we can serve a larger population, and that could be a very good source for remittance. As far as our ask is concerned, I think private healthcare investments have to be looked from a different lens compared to a regular corporate. And that is what will make a difference. Currently, healthcare has to operate in all the parameters which are same as any other business. And if they have to provide that kind of returns and they have to be responsible to their stakeholders, they can obviously have certain constraints in providing the level of service or the kind of service which is required, especially to the economically disadvantaged people.
So very quickly, my second last question, because I know we have the finance minister here at 6. Earlier, medical colleges, by and large, at least some of them were a complete racket. There was capitation fees. It was a bizarre situation. Do you see a significant change in that, which means we now have better manpower? And I'm talking about both skilled and non-skilled.
Yeah, so a lot of reforms have been done in medical education in the past 7-8 years. And the medical council concept has been changed, and that has brought in a lot of transparency. The digital health will bring in further transparency. The information will flow freely, and the whole medical curriculum also has been revised. So with that, we would definitely have larger number of supply. Then comes the question of quality. The government is very keen to look at accredited institutions, and they are making sure that all the insurance providers, etc., are ensuring that the hospitals are accredited and there is a certain kind of quality and safety in patient care in those hospitals, whether be public sector or private sector. So definitely once we have larger number of availability of clinical talent, automatically the standards will also improve. Indian doctors are second to none.
Last question. My late grandmother used to force me to have haldi, black peppercorn, nimbu in a, well, tequila shot glass. She didn't know it's tequila. And that created a level of immunity, and I never got COVID, touch wood. Do you believe the time has come as India enters its Amrit Kal? We've brought about a huge fillip to Ayurveda, to traditional medicines. Do you see that playing a great role? Because A, of access, and B, of cost?
See, our traditional medicine has got a very important role in especially managing chronic illnesses. And that has been proven for a long time. However, modern research methodologies have not been used, but that is started to happen now with the current government. And these things are coming into focus now, and as a result of that, I am pretty sure that our traditional medicine, Ayurveda, and all other systems will play an important part in the larger ecosystem of healthcare.
Dr. Raghuvanshi, thank you so much. He is perhaps the only professional running a large chain. Otherwise, most of them are owner-managers, and therefore their interests and their incentives are slightly different. I'm not saying dishonorable, only different. Thank you for being a delightful audience. Stay healthy, have haldi, and be good.
Thank you.